Epidemiology of diabetes mellitus. As of 2016, 422 million people have diabetes worldwide, up from an estimated 382 million people in 2013 and from 108 million in 1980. Accounting for the shifting age structure of the global population, the prevalence of diabetes is 8.5% among adults, nearly double the rate of 4.7% in 1980. Type 2 makes up about 90% of the cases. Some data indicate rates are roughly equal in women and men, but male excess in diabetes has been found in many populations with higher type 2 incidence, possibly due to sex-related differences in insulin sensitivity, consequences of obesity and regional body fat deposition, and other contributing factors such as high blood pressure, tobacco smoking, and alcohol intake. The World Health Organization estimates that diabetes mellitus resulted in 1.5 million deaths in 2012, making it the 8th leading cause of death. However, another 2.2 million deaths worldwide were attributable to high blood glucose and the increased risks of cardiovascular disease and other associated complications, e.g. kidney failure, which often lead to premature death and are often listed as the underlying cause on death certificates rather than diabetes. For example, in 2014, the International Diabetes Federation, IDF, estimated that diabetes resulted in 4.9 million deaths worldwide, using modeling to estimate the total amount of deaths that could be directly or indirectly attributed to diabetes. Diabetes mellitus occurs throughout the world but is more common, especially type 2, in more developed countries. The greatest increase in rates has however been seen in low and middle income countries, where more than 80% of diabetic deaths occur. The fastest prevalence increase is expected to occur in Asia and Africa, where most people with diabetes will probably live in 2030. The increase in rates in developing countries follows the trend of urbanization and lifestyle changes, including increasingly sedentary lifestyles, less physically demanding work, and the global nutrition transition, marked by increased intake of foods that are high energy dense but nutrient poor, often high in sugar and saturated fats, sometimes referred to as the Western style diet. History of diabetes. Diabetes was one of the first diseases described, with an Egyptian manuscript from c. 1500 BCE mentioning 2 great emptying of the urine. The Ebers Papyrus includes a recommendation for a drink to be taken in such cases. The first described cases are believed to be of type 1 diabetes. Indian physicians around the same time identified the disease and classified it as madhumeha or honey urine, noting the urine would attract ants. The term diabetes or to pass through was first used in 230 BCE by the Greek Apollonius of Memphis. The disease was considered rare during the time of the Roman Empire, with Galen commenting he had only seen 2 cases during his career. This is possibly due to the diet and lifestyle of the ancients, or because the clinical symptoms were observed during the advanced stage of the disease. Galen named the disease diarrhea of the urine, diarrhea urinosa. The earliest surviving work with a detailed reference to diabetes is that of Aretius of Cappadocia, 2nd or early 3rd century CE. He described the symptoms and the course of the disease, which he attributed to the moisture and coldness, reflecting the beliefs of the pneumatic school. He hypothesized a correlation of diabetes with other diseases, and he discussed differential diagnosis from the snakebite, which also provokes excessive thirst. His work remained unknown in the West until 1552, when the first Latin edition was published in Venice. Type 1 and Type 2 diabetes were identified as separate conditions for the first time by the Indian physicians Sushruta and Charaka in 400 to 500 CE, with Type 1 associated with youth and Type 2 with being overweight. The term mellitus or from honey was added by the Briton John Roll in the late 1700s to separate the condition from diabetes insipidus, which is also associated with frequent urination. Effective treatment was not developed until the early part of the 20th century, when Canadians Frederick Banting and Charles Herbert Best isolated and purified insulin in 1921 and 1922. This was followed by the development of the long-acting insulin NPH in the 1940s.